This is a KNUST School of Veterinary Medicine study. Please subscribe, like and share.
Apart from the muzzle, which is a physical restraint method, we also put on gloves as we are also examining the animal, so as not to also expose ourselves to also other infections. The animals can have zoonotic infections like mange, which can be transmitted to the veterinarian that is examining the animal, and even also other lesions that the veterinarian might examine that might also expose him or her to other infections. So it's very important to wear gloves. Apart from that, too, some animals too can also suffer from respiratory infections. And now, with how viruses are mutating and all that, and it's also important to also put on nose mask as you're also examining the animal, so as not to expose yourself to respiratory infections. Rabies too, it's very important as a clinician to be vaccinated against rabies, since it's a very important zoonotic disease that once you are bitten and then you didn't take it seriously and clinical signs starts, there's nothing that can be done to save you.
Infection control is a basic but essential practice in human and animal healthcare settings to lower the potential of pathogens spread within settings by obstructing access to the source, transmission mode, or host. The practices of hand hygiene, disinfection, shafts management, vaccination and isolation or quarantine involve ways of reducing the threat of zoonotic infections in healthcare systems.
What then is infectious control practices? One of the things infectious control practices entail is biosecurity consciousness in terms of PPE. Where the way you dress, did you wear gloves? After finishing, did you wash your hands? Did you wear your goggles? Did you wear your nose mask? Did you wear your boots and all that? These are PPEs essential to prevent infection from coming to you. When you even use your lab coat, how often do you wash your lab coat? What are those things you put in place to prevent infection in your establishment? You come to their clinic, you look at the clinic, how often do you wash? How often do you clean? What are those detergents you use? What are those disinfectants you use? These are practices that must be routine. And how are we following it? Are we following it religiously in the clinic? Are we following it during our ambulatory services? Are we even teaching our students to follow it in the course of our program? These are things that we were looking critically at so as to create that consciousness of infectious control. Because when you are talking about occupational hazards, you are talking about people that need to take precautionary measures so that they will not be infected. So we are looking at this critically so that we'll be able to advise the veterinarians and the technicians on what to do and to upscale our consciousness.
My research was to look at the infection control practices that are used by veterinarians to protect themselves when they are carrying out their daily duties. Now, we know infection control practices involve the hand washing, vaccinations that they take to protect themselves from diseases that they might get working with these animals. So we try to exploit what they do in specific situations when they are handling an animal, when they are taking blood sample, when they are picking fecal samples, whether they wear gloves, whether they wear nose masks and all to protect themselves. So in my study, we we had 150 respondents, and these include 67 veterinary surgeons, 20 veterinary nurses, and 63 veterinary technicians, which comprises of animal health officers and veterinary technicians. We asked these respondents whether they were vaccinated against the human anti-rabies pre-exposure vaccine, and whether they were vaccinated against COVID, to try to see how they are protected when they are working. We found out that 29.3% of the respondents were vaccinated against rabies, and 70.7% of the respondents were unvaccinated, which is quite high. Then we also found out that 76.3% were vaccinated against COVID, and 23.7% were unvaccinated against COVID, which we find as normal or in this particular population. We also try to score these veterinarians according to a scoring system that we adapted to see how effective they were protecting themselves. When we did the precaution awareness score, we found out that 75.3% of the veterinarians had low PA ranking, which is low precaution awareness score, indicating that majority of the respondents were not protecting themselves well when they were doing their work. And we tried to find in this low PA ranking which particular group were having the lowest and which particular group were having the highest. When we went further to look at the qualifications against the precaution awareness score, we found out that even though veterinarians have a generally low precaution awareness score, they were the least among the three qualifications when it comes to with 61.2% within the veterinary respondents having low PA ranking, and 90% of the respondents of veterinary nurses had low PA ranking, and 85.7% had low PA ranking when it came to veterinary technicians. So this overall indicates that the veterinary practitioners in Ghana have low PA ranking, and we try to find out if there were any association between the low PA ranking with any of the demographic, like whether males were generally having low or females were having low disease. We found out that it was consistent that males were recording low precaution awareness score with a PA value of 0.4, which indicates that generally males think they are not they might not need extra precaution when they are working in this particular field. My recommendation that when you look at the COVID and anti-rabies vaccination, you could see that COVID had a high vaccination among the respondents of 70.3. This of 76.7. This indicates that when they publicize or when they advocate for people to vaccinate themselves, it improves the vaccination, and we have found generally low publicity of the human pre-exposure anti-rabies vaccination among the veterinary community. We also recommend that there should be infection prevention control policies at veterinary hospitals, or a national policy on infection control practices among the veterinary practitioners, just like in human medicine or in the human health. We have some of these policies that they follow.
This is a KNUST School of Veterinary Medicine study.